Hello, my name is Dr. Grace Bachman. I'm a public health practitioner and I'm the medical director here at Sonotech Medical Center. Globally, April is dedicated for autism awareness. And so today we're going to shed some light on what autism is, especially for parents who have kids with autism, how best they can live meaningful lives. Is autism really common?
It depends on the setting in which you are in, because autism is actually more common than a lot of us believe it to be, and there have been increased incidents in the past few years. But before we are able to say someone has autism or not, it's important to understand what it is. When we talk about autism, like you said, it's a spectrum disorder. So some people are on the mild end of the spectrum where they may have little to no symptoms, and some people are on the very extreme end of the symptom where it's obvious that they do have autism. And autism is a neurodevelopmental disorder. What this means is that it affects the neurologic function, it affects the development of the child. And to say someone has autism, you have to have had these symptoms in the early development era, so in the first few years of life.
Okay, so before we go on, from what you are saying, it means if I'm pregnant as a woman, there's no way I can tell that this child I'm carrying eventually would have autism. Is that what we are saying?
Yes, that's true. When a woman is pregnant, there's no way of telling. It isn't like an obvious congenital defects like an umbilical defect that a scan can pick up. There aren't blood tests that we can do to diagnose autism when a woman is pregnant. And this is because the way we usually make a diagnosis is clinically. So we'll usually ask the parents some questions, because with autism what happens is that there are impairments in how they communicate, in the individual social skills. There are impairments in certain behaviors, so they may have repetitive or stereotyped behaviors. And because of these, their interactions with other people are not like you and I would. Yes.
So what's the earliest age with which we can actually diagnose that someone has autism? From what you are saying, it means that diagnosis has to come from the doctor, right?
Yes, but a lot of the parents actually pick it up and then they will report to the hospital. So some parents may say that at about 18 months, they've noticed that their child doesn't communicate like they used to. They might say that initially their child was saying mama, they were saying baba, they were saying dada, they were waving bye-bye, but now they don't do that anymore. Or when there are other children, they don't play with the children, they prefer to isolate themselves and play by themselves. Or they are overstimulated by certain things. For instance, if there's loud noises or if there are certain foods, they wouldn't want to eat those because of the difference in texture in the food. So parents are usually very good at picking them up and then bringing them to the hospital so that we can diagnose and manage them.
So we said that it's a spectrum.
Yes.
So can you take us through the ends of the spectrum? Like what's the worst of when it comes to autism and what's like the best?
Okay. The most common thing that parents will notice is their social interactions. So usually when you're playing with a child or talking to a child, you expect that they'll have eye contact with you like you and I are having now. So good eye contact is one of the things you expect a child to develop as they are growing up. But children with autism may not have that eye contact with you. When a child wants something or wants to show you something.
But when it comes to eye contact, naturally there are some people, even in adulthood,
who don't make eye contact.
So if we throw it out there that anyone not making eye contact has autism, like to what extent would you?
Okay, so it's not just one thing. It's a combination of things. So eye contact is one of the things. But you don't just say if someone doesn't have eye contact, then hey, you have autism. No. But it's a combination of things. So things like eye contact, usually when a child wants something, what will they do? They'll point to something or they'll take you to it or they'll speak. If there are delays in speech or there's a regression in speech, when we say regression, what it means is that initially they were doing something, but now they've gone back. So they are no longer doing things that they used to do, or they have limited vocabulary, or they don't have shared interest. Pointing is a sign of shared interest because it's like you are interacting with the people around you. You are pointing so that they can also see what you are looking at. So if they are not doing things like that, or the parents notice that some of them actually don't walk, or they have delayed development, not just their speech but their motor development as well. And there are some children who have repetitive behavior or specific interests. So some children may be interested in only playing with cars, or every morning when they wake up they want to do things a certain way. Once you change their routine, then they can't handle it. So those are all subtle signs of autism. And unfortunately there isn't that one diagnostic test that we can use for children with autism, because if it's malaria, you do a blood test. It's malaria, you treat. With autism, what we usually have to do is that we use screening tools, usually questions that we ask or things that we observe with the children. And then based on these questions that we ask, there's a scoring system. And whether it's low risk, medium risk, or high risk, then you can say that this child most likely has autism.
So now back to what causes it, because we've already established that you cannot confirm if the child you are carrying would have autism or not. And it is only when the child starts development that when you start noticing some of these changes, then it draws your attention to it. I mean, your clinician's attention to something like that. But has there really been, although it's a neurodevelopmental disorder, has there been a specific cause?
Unfortunately, the exact cause of autism is not known. There are still lots of research that's going on trying to figure out what exactly causes it. But what we have found out is that there are some risk factors which could increase a child's development of autism. So for instance, if a child has parents who are more advanced in age, so older parents may be at increased risk of having...
older, what are we talking about?
Not me or you.
Older, what are we talking about? What age are we looking at?
Usually above 35, 40.
Okay.
We are getting there. Usually above 35, 40. And it's not just the maternal age, but the paternal age as well. And then if you have certain genetic conditions, children with Down syndrome at increased risk of having autism.
So you can actually have Down syndrome and autism together.
Oh
my goodness.
I know, it's not enough to have just one. You can have both conditions existing together. And then if a child is born preterm, or they have a very low birth weight, for some reason, they're also at increased risk of autism. Now, we are not saying that all mothers and fathers who are older will have children with autism, or all preterm babies. Yes, it's a risk. The important thing is, once you know that there are these risk factors, you bring them to the hospital for follow-up, so that if anything does come up, it can be managed appropriately. So
there is no spiritual implication when it comes to autism.
No.
I mean, and I think we need to really put this out there, because we're all expecting kids to behave a certain way, and once parents don't see the kids behave in a particular way, you know, our society. How about the caregivers? So I am pregnant, I deliver, I see certain signs, symptoms, I come to the hospital, and then the diagnosis of autism is made. Like, what happens next to the child? And then aside that, what happens to, like, what role do I have to play as a parent?
Hearing your child is sick, it's worrying. Even for a short-term illness like a pneumonia or even the common cold. And autism it's a chronic, lifelong condition. It's not like we can give medication that will take it away, unfortunately. But there are still interventions that we can put in place. And it's important for caregivers, for mothers especially, to know what the normal development is, so that if they pick up anything, they report to the hospital, and then interventions can be put in place, because the longer we delay, the worse the outcome. But once a diagnosis of autism is made, it doesn't mean that your child isn't going to be able to fit into the society. Like you said, it's a different ability. It's not inability. So they can still function as productive members of the society. Albert Einstein had autism.
When I saw it, I was actually really surprised. And personally, I've actually come across some people who are autistic I think sometimes they are skewed when it comes to their intelligence. There's one guy I encountered who was so sharp when it comes to math.
So even though they have these impairments in their social and communication skills, they sort of make up for it in other aspects. So usually they are very intelligent, they may be very good at math and critical thinking, they may be experts in a particular field, they may be excellent with music, they can hear something once and be able to play it on the piano or the violin or whatever. So children with autism should not be limited. So the first thing is, if you notice any developmental delays, if you are concerned about your child in any way, always report to the hospital early so that interventions can be put in place. And these interventions, even though we may recommend them in the hospital, it's things that you do at home as well that will help. So for instance, we'll usually, first of all, refer a child with autism to see the ENT specialist.
Okay.
Or go for a hearing assessment to make sure that they don't have any issues with that, because a lot of them have speech delay. And if we miss a hearing impairment that is causing the speech delay, that would be a great disservice. So we have to refer them to make sure that there are no hearing impairments, and if there aren't, we can start speech therapy for them. And speech and language therapy has caused great improvements in children with autism. They've been able to start communicating verbally, but then again, it's a spectrum. So not everyone will be able to communicate verbally, but even if they are not able to communicate verbally, there are non-verbal communication skills that they can pick up. And then there's also psychotherapy, because not just for the child, for the caregivers as well, because chronic long-term illness is not easy having a child.
I remember one of the times in the consulting room, a mother came with like 3 kids, and I think the second one was the one that was autistic, and like the whole time, you know how you mentioned sometimes they are fixated on one thing, will not sit down, very hyperactive, and you could see like from the mother's face, you know, so worried. The child just opened the water, you know, the whole room was, and I'm like, we understand, but you could see that, you know, very frustrated. Are there like any specific interventions to help the caregivers as well?
I think talking about it is a big first step, because even as a society, we tend to stigmatize even when we don't intentionally do it. So a mother with a child who has autism may not be able to attend church, because when she goes to church, they'll say your child is making noise, or the child will be distracting other people, so she will not go. So we should be more open. We should try not to stigmatize, because I mean, everyone deserves a place in society. We shouldn't make them isolate because the child has this condition. It's important not to do that. I think that's the first step. And when the psychologists come in, there are various behavioral therapy that can help the child to cope, help the mothers, the parents to cope as well. And occupational therapy is also important, because they may have issues with their day-to-day activities, for the children especially. So getting dressed themselves, brushing their teeth, finding alternate means of doing things, interacting with other children is all important to help with development of their skills.
As we are home with the child, are there any specific red flags that we should look out for?
All right. If you notice that your child doesn't have shared interest with you, for instance, they don't point when they want to show you something, or if there's something new in their environment, they won't want to share that with you. Or if you notice that if they want something, rather than point to it, they'll go and take it themselves. Or they don't pay attention when you call their name. I mean, generally, children might not pay attention to you when you call them, but if it's on a different level and you think that, oh, they can't hear, then that could be a sign that they have autism. A lot of the time, parents will say that they've noticed their child is tiptoeing, so walking on their tiptoes instead of normally with the flat parts of their feet. That could also be a sign of autism. Again, it doesn't mean that all children who tiptoe have autism, because at a certain age it's normal. After a certain age, if it persists, it could be a sign. Yes. And then repetitive movements. They always want things to be done a certain way, or they are overly stimulated by certain loud noises or textures. That could also be a sign of autism.
If probably I have a neighbor who has a kid with autism, like, what can I do as a good neighbor, as a good member of the society, so far as the parents are concerned, so far as the kid is concerned?
Be understanding. Number one, don't stigmatize. if you've noticed anything that the parents haven't noticed, you can bring it up to them in a nice way so that the attention that the child needs can be sought after.
As you rightly said, autism is a different ability. And you even mentioned people like Albert Einstein, who, is autistic. So if someone has autism, it doesn't mean the person is not able to contribute to society. We all have a role to play, putting our hands on deck, giving them a supportive environment.